What's the plan? What are you gonna do? Y'all have all these meetings, and I don't know what you're gonna do next. Work with us, people. The Buffalo Center for Health Equity, along with our partners at the Erie County Office of Health Equity, the UB Community Research Institute, and all of those who have been working with us on Igniting Hope. We've done 8 great conferences. In our last conference we asked you for ideas on how we can make our community better. Well, we're going to follow up. We do have a plan. And so we need you to come and be part of our conversation on February 26th at 5 p.m. at the Buffalo History Museum, One Museum Court. 5 p.m., February 26th. We will have a conversation about the follow-up from the 3 virtual sessions and the Igniting Hope conference we had back in September. Remember, we said, and we laid it out, that there are 5 very important things that need to happen in our community in order for us to get health equity. 1 is bringing every child up to grade level in their reading and their mathematics. Currently, less than 20% of Black children in the school systems right now are reading at their grade level, and many are 2 and 3 grade levels behind. We need to fix that. We need to work together to bring every child up to grade level. Therefore, they can get to the point where they can get a good job. Bringing us to our second piece. We have to make sure that everybody in our community is working at its maximum capacity. He or she should be working at a living wage job, making good money so they can take care of themselves and their family. That's not happening right now. So how can we fix it? Now, it's be very difficult to get in training programs and get a good job if we're struggling with our literacy, so they're connected. That leads us to our third piece. That is making sure that everyone is living in quality, affordable housing. Sadly, too many people in our community are living in what we would call substandard housing, not because the people are substandard, but because there's issues as it relates to mold, issues as it relates to other environmental things that are going on in their homes. It's drafty, and there are things that many houses are not up to code. So we need to bring every house up to code and make sure that everybody is living in an affordable, comfortable, and safe house. 4, we want to make sure that everybody has access to primary care. We know that if a person has a good relationship, a culturally competent relationship with a primary care physician, he or she are going to have better health outcomes. And then 5, making sure that everybody has access to healthy food. Now, they're all come together, right? If a person is struggling with their reading or they're having educational challenges, it's going to be harder for them to have the skills in order to get a better job. And if you don't have a better job, you're not making enough money to get better housing, then that's going to create problems. And then having access to primary care. A lot of times we don't have enough primary care physicians. Some of them are not located in our communities. And sometimes the ones that are located in our communities, we're having challenges accessing them. So we got to push through those issues. And then 5, we all know about the situations around living in places where there's not access to healthy food. But it's not only about having a facility, but it's also being able to have the resources, the money to buy healthy food. So can you see how all 5 of those are connected? Right? We can't just address one. We got to come up with a comprehensive plan to address all 5. And then certainly issues around transportation, daycare, all those things are part of the solutions. We asked you last summer and in September, what were your ideas? And so we came up and we've developed a summary document from all the things that you shared with us at Igniting Hope and in our virtual sessions. And now we're going to pull all that stuff together and create 5 working groups, or maybe 1 working group. We don't know, but a working group that will help us do the follow-up and then develop a multi-sector collaborative. The multi-sector collaborative will be the engine. It'll bring in the different parts of our community, from grassroots, from business owners, from educational institutions, all the important stakeholders that we need to bring together in order to execute a strategic plan to bring health and wealth and wholeness to our community. To that end, we're going to bring in a special guest, Dr. Hana Hamni. Dr. Hamni is working currently on multi-sector collaboratives in Los Angeles and in Oakland, and has done some very innovative work in Newark, New Jersey. She has agreed to be a part of our work, to be a part of our team, to coach us, to help us, to share with us her expertise on how to build the type of multi-sector collaborative that will execute a strategic plan that will bring us health equity for our region. And we need your participation. So please join us February 26, 5 p.m. at the Buffalo History Museum. You will hear all the follow-up, all the plan. We were listening at Igniting Hope. We were listening in our virtual sessions. And now we're going to provide to you the documents, the feedback, so that we can move to the next phase of our work. We have already created a very powerful partnership. We've already birthed 3 very important organizations: the Buffalo Center for Health Equity, the UB Community Research Institute, and the Erie County Office of Health Equity. And we have many other partners that have been working with us to do the things that we need to do to bring health equity to this region. So please join us February 26th, 5 p.m. We're going to feed you. If anybody's ever been to any of our events here from the Buffalo Center for Health Equity, you know that we practice good hospitality. We're going to make sure that you're fed. We're going to make sure you have the materials. We're going to make sure that we listen to you. So I'll look forward to seeing you on February 26th. If you want more information, go onto our website, buffalohealthequity.org, buffalohealthequity.org, and be a part of the solution. So you can say, yeah, there is a plan, and you need to get involved in working on developing that plan and implementing that plan for our community. Thank you.